Priya, a first-year medical student, sat hunched over a physiology textbook, the words blurring together after hours of study. Professor Alistair, her sharp-eyed professor, noticed her fatigue. "The brain can only absorb what the body can endure, Priya," he said gently. "Time for a break, I think." Priya nodded and sprang to her feet, eager to stretch. But as she rose, the library shelves tilted violently, and her vision filled with black spots. She felt a wave of dizziness and grabbed the table to steady herself. Professor Alistair's hand was instantly on her arm, guiding her back into the chair. "Whoa there. A classic case of a sluggish Baroreflex Brigade," he said, his tone calm. "You've just demonstrated orthostatic hypotension. Let me explain what happened to your internal troops. Imagine your circulatory system as a disciplined brigade," he began. "Your blood is your army. While you were sitting, your troops were garrisoned evenly. But when you stood, gravity, the great general of physics, commanded 500 to 1,000 milliliters of troops to pool in the barracks of your lower body. This venous pooling caused a sudden drop in venous return to the heart, your brigade's command center," Professor Alistair continued. "As a result, cardiac output fell and blood pressure dropped. Your brain, the high command, was suddenly at risk of a critical supply shortage. But your body has sentinels, baroreceptors in the carotid sinus and aortic arch. These pressure sensors detected the drop and sent an urgent, afferent signal via the glossopharyngeal and vagus nerves to the control center in your medulla." Priya touched her own neck, picturing the chain of command. "So the sentinels sent a warning?" she asked. "Precisely," said the professor. "A warning that initiated a powerful countermaneuver. The control center launched a sympathetic response," he explained. "It ordered an increase in heart rate and contractility, and crucially, peripheral vasoconstriction. This squeezed the pooled troops in your veins and arteries, forcing them back uphill against gravity towards high command. In your case, after hours of inactivity, your brigade's response was delayed. That brief moment of cerebral hypoperfusion caused your dizziness. Had it been a second longer, High Command would have initiated a, quote, tactical shutdown syncope to flatten the battlefield and restore blood flow instantly." "So, the clinical takeaway?" Professor Alistair smiled. "Advise your patients and yourself to rise slowly. A simple calf muscle pump before standing gives the Baroreflex Brigade the moment it needs to mobilize." Priya smiled, a complex process, now a memorable story she would never forget.